In this video, we will talk about the management of non-ST elevation myocardial infarction or NSTEMI. Just a quick reminder, NSTEMI refers to a set of acute manifestations associated with the rupture of an atherosclerotic plaque with the formation of a thrombus on its surface. Upon admission to the coronary care unit, the patient undergoes initial procedure and assessment. This includes positioning the patient in a seated position and monitoring vital signs such as heart rate, blood pressure, respiratory rate, and oxygen saturation. Additionally, an initial assessment is conducted, including the measurement of troponin levels, creatinine, glucose, and a complete blood count. Immediate resuscitation measures are implemented in case of shock. The acute phase of treatment involves drug administration, including initial aspirin at a doses of 115 to 300 mg orally or intravenously, followed by 75 mg orally for long-term management. Other antiplatelet agents such as prasugrel or clopidogrel are also administered. Additionally, low molecular weight heparin, especially enoxaparin, is prescribed throughout the hospitalization to prevent thrombosis. Coronary perfusion with revascularization is determined based on the patient's risk level. For low-risk patients, medical treatment is typically preferred. In case of intermediate risk, coronary angiography is performed within 72 hours. If risk factors are present, such as a recent myocardial infarction, presence of a bypass graft or stent, patient being diabetic, or having renal insufficiency. For high-risk patients, coronary angiography is performed within 24 hours in case of ECG changes or troponin elevation. If very high risk, coronary angiography is performed within 2 hours in case of hemodynamic instability, arrhythmia, or refractory acute pulmonary edema. Thrombolysis is never used due to the risk of platelet-rich white thrombo. Revascularization options include angioplasty, which involves balloon dilatation with a stent placement. After hospitalization, the discharge medication treatment, known as the acronym BASIC, is initiated. B is for beta blockers, such as bisoprolol, except in case of decompensated heart failure or asthma. A is for antiplatelets, including aspirin at a dose of 75 to 116 mg per day for life, combined with clopidogrel for 1 year. S is for statins, such as simvastatin. I is for angiotensin converting enzyme inhibitors, and C for correction of cardiovascular risk factors and cardiovascular rehabilitation. Thanks for watching, and I'll see you in the next one.